Welcome to The Heart of the Matter, an Our Place podcast, where we look at the issues surrounding homelessness, addiction, and mental health on the streets of Greater Victoria.
Hello, I'm Stephen Seltzer, Manager of Philanthropy for Our Place, and I'm pleased to welcome back Diana Gibson, Executive Director of the Social Planning Council of Greater Victoria, to today's Heart of the Matter podcast. The Council recently announced the findings from the point-in-time homelessness count here in Victoria. Welcome, Diana.
Thank you.
Before we start, I should mention that we respectfully acknowledge the Kwanghan-speaking peoples of the Songhees and Esquimalt nations for their gracious hospitality while we provide programs and services within their ancestral lands. Diana, going back to our previous conversation we had a couple months ago, can you remind people of the point of the homelessness count and how long the Social Planning Council has been overseeing the count?
Thanks. The count is something that is done every 2 years. There was some differences in time, of course, with the pandemic. It's often not often, but not always part of a national and province-wide initiative, and certainly with the 2023 count, we were coinciding with a whole bunch of other cities in the province that are doing counts this year. And it's something that's done in conjunction with the Capital Regional District as the host partner of Reaching Home Canada funds for homelessness initiatives that funds the point-in-time homeless survey.
And before we dig deeply into the results, certainly one positive that you told me about before was highlighting how it was amazing that all these different groups in our community actually got together to administer the count this year. Can you talk about that for just a bit?
Yeah, each time we do the point-in-time homelessness survey, there's over 170 or 180, depending on the year, people that come out. And we were expecting post-pandemic that might be lower, that there might be some stigma and fear with people in the street. But we saw that, it's a significant number, the same number of people come out ready to go out on the street and do surveys through the community. And we're really, the initiative really is a rising up of the community to address and acknowledge the challenges we face collectively around homelessness.
Right. Now, getting to the heart of the matter, the count itself, the results told us that at least 1,665 people were experiencing homelessness on March 7th, 2023, the day of the count. 601 people were in transitional housing, 282 people were emergency sheltered, 410 people were in the public system like corrections or hospitals, 242 people were unsheltered, 85 people were couch surfing, and 45 people were in unknown sleeping locations. And of course, that's just the numbers based on who responded to the count. What stands out to you about these numbers compared to the previous count in 2020?
Well, I mean, overall, the number is quite similar. It looks like it's a bit of an increase over the 2020 number, but that's because corrections was included this year and they weren't in 2020 because of capacity issues. So if you remove the 200 and some odd from corrections, you in fact have a similar number as in the prior 2020 count. So the number is similar. There's been a little bit of a shift between folks that are unsheltered and emergency sheltered versus in transitional housing and public systems. So it's just a little bit more, and that's something that we would expect to see a little bit more in the numbers that are in some kind of temporary accommodation or transitional or public system hospitals, corrections, and but overall the numbers similar.
Do the numbers reflect when COVID happened and then the provincial government purchased hotels and so on to house more people? Did the numbers show that at least more of a segment of the population went from homelessness to temporary shelter, or the numbers just continued up on all sides?
You do see a little bit more of a number in transitional housing and public systems, and a little bit of a decline, but mostly that's in emergency shelters, a little bit less people using emergency shelters. So we did see the numbers decline in emergency shelters during COVID because of distancing restrictions and things like that.
Right.
But what you don't see is the COVID effect, because the numbers are pretty similar in the unsheltered and emergency sheltered overall. And that significant rise in people that were on the street with the reduced numbers in the emergency shelters during the pandemic has mostly been addressed post-pandemic.
Okay.
So just to say that there is a little bit of a shift to folks that are in temporary housing, but overall the numbers look relatively similar.
Now, since you've announced the numbers, you've had quite a few media interviews and have talked with lots of key groups about the results. What are most people asking about? What's the main things that people, reach for and go, yeah, that's the number I need, or that helps me to understand what's going on?
I think that the thing that people are really noticing is, although there's been some shifts in where people are in terms of the numbers, what we wanted to see was a significant decline in the overall number of people who don't have long-term permanent housing. So the people experiencing homelessness. And we didn't see that significant decline. So that tells you that the housing crisis is pushing people into homelessness, as the city has been working and the province has been working to try and get people into housing, supportive housing and market housing. That the back door is still open with people coming into homelessness because of the housing crisis that we're in right now.
Right. And we put out a 4-point plan recently, and I'll talk to you about that in a bit. But certainly when we got response from the government who have been supporting our housing and so on, it sounded like there weren't many short-term solutions coming. It sounds like there's no quick fixes. This is going to take years to provide housing and so on. Do you know anything I don't?
I wish I knew that there was a magic silver bullet coming. We run the rent bank for the region at the Social Planning Council, and we see households at higher and higher income levels coming into the rent bank in dire need of help to avert an eviction. Right. So we know that all households in the region are feeling impacted by the housing crisis. And households that previously haven't been at risk are starting to be at risk. A lot of them have never needed to ask for help before. So we definitely see the impact of the housing crisis, and we know that building housing takes a long time, and the kind of housing, the volume of new units that we need at deep affordability is going to take time. And in the meantime, with the tight vacancy rate we have right now, we're going to continue to see a challenge. So we do need both that long-term action, and we need some really good focused short-term help.
Absolutely. Is there anything that people haven't been asking you about that, looking at the point in time count, that you think people should know?
There's a few things. I mean, one of the things we noticed was there's a higher proportion that are seniors, and that's highly concerning because we've also been hearing from frontline workers that seniors are falling through the cracks. They're on fixed incomes as the market, prices go up. You see those people on fixed incomes get squeezed. More the same thing with people on disability and social assistance. We saw a higher proportion in this count of people on disability, though the overall number of people on income assistance was similar. We saw a shift to a higher portion of people on disability. And it's really shameful to be in a society where people who have met the very high barrier access for application for disability social assistance, that those people are on our streets, right. That we're a society that isn't taking care of the people that can't work and are in need of help. So seniors, people on disability, certainly very vulnerable populations. And then of course on ongoing high proportion who are Indigenous and have, legacies of colonialism, residential school and day school impacts. So a lot of those, things that we've seen in the data before continue to be very visible in the data today. And then those vulnerable populations that we're seeing. One other thing that we saw this year is the first time we asked about people being discharged and evicted into homelessness. And we did see almost 34%, I think, have been either discharged or evicted into homelessness, a significant portion that are coming out of corrections and public health into homelessness. So that's also something that we have in the data now that we haven't seen before. That's something that needs to be part of that short-term solution, that people are coming out of healthcare and corrections facilities and there's nowhere for them to go.
Right. And I imagine, even though this is a count for Victoria, this of course reflects the same things we'll see throughout the province and throughout the country. There's just, again, governments come, governments go, and some provide better solutions than others. But these are problems that have plagued us for so long that we're just not seeing. It's so slow to move any kind of needle.
Well, on the positive note, we actually know we can look at the data and the history of investment in housing and the withdrawal of the government from public and nonprofit housing and co-op housing, and we can see how this problem was made. It is a crisis of the delivery of housing in our community and in our economy. And so as we can see how this crisis came to be, we can see the policy solutions to fix it. This was a policy created problem. It can be fixed through policy. So that's the positive side, that we know there are solutions. We do have governments that are stepping up to the plate. The scale of the effort needed, particularly at deep, affordable and affordable units, certainly isn't something that I see any government really committing to, but certainly governments are stepping up to the plate now, and it is something we can fix. And I'm optimistic. However, as you said, I feel like it'll take a few years. So that, what do we do with this population that we know is in need for while we get those policy solutions fixing it?
And certainly, I guess a caveat I should mention for our place is that we do see a lot of support from the government, because they see the work that we do in our community, just like other service providers, and we have gotten quite a bit of support in being able to provide some pathways for people that we serve, but it's slow going. As part of that, we did put out a 4-point plan in an effort to push conversations about homelessness and stimulate some action. And I was wondering if you could help me look at them and just see if the Planning Council is basically on board with what we've been asking for.
Happy to review the 4-point plan.
Okay. So the first one was conducting intensive outreach programs with those on the streets to better understand how they ended up there and what it would take to get people off the streets.
Absolutely. And, the point in time homelessness survey does provide some of this data. So it's a pretty comprehensive survey, and we had over 700 individuals that are on the street, engaged individuals and people experiencing homelessness fill out the survey. So it does give you a bit of a profile of factors that led to their experiences of homelessness and service and program needs that they've requested, that they say their needs are, right, and the services they'd like to access. So there's a good start. We've got current data that's pretty comprehensive. It's anonymous, which is the difference between a by name list and this. The point in time survey is it's anonymous, so people who aren't wanting to be identified can fill out that survey and give us their stories. And that's why it's really complementary to the by name data that some of the facilities have in giving you, and it's also the same survey methodology every 2 years, so we can see those trends over time, like that higher portion of seniors or the shift to focus on disability, social assistance. So certainly that'll give you a little bit of that profile, and then engaging more directly with individuals in the community around their needs for exiting homelessness is going to be important too.
Absolutely. Number 2 is providing and placing people in a range of housing sheltering options, including emergency low barrier shelters, long-term shelters, complex care housing, transitional housing, and permanent supportive and independent housing. So certainly looking at that continuum of care so that you can move people on to the next step in their journey. And hopefully if people do falter, they don't start again at the streets. They might start in emergency shelter again and transition. So that certainly was something we've been advocating for a long time.
Yeah, and we know that for people whose journey it is, even those that are choosing to end a substance challenge, that can take multiple efforts, and being able to have a re-entry point into that process is a really important part of that healing journey, and have it be appropriately culturally sensitive, trauma-informed, meeting them where they're at. So we know that there's a lot of gaps right now in the system in terms of the continuum of care, both services and housing. In terms of this conversation about housing continuum, one of the things that some of the other jurisdictions in Canada and London, Ontario has started doing this is having 24/7 sheltering designated sites with supports, so that the continuum doesn't begin at on the street unsheltered, and they take anybody who's on the street unsheltered and put them into designated 24/7 sheltering sites, so that their belongings, they don't have to pack up their camp and lose their belongings regularly, and they have a designated place where they can keep their belongings, and then they can have services come to them and be met where they're at in terms of needs. So that's an interesting model. Victoria doesn't have that. It did have it with 940 Caledonia and Tiny Town a little bit, but other jurisdictions are looking at they're looking at filling this gap while they get the housing crisis stock coming on stream, filling that gap with some designated sheltering sites, something Victoria could look at and talk about.
Right. I know, I mean, certainly a concern of somebody who's living unsheltered in terms of finding housing is they're afraid to leave their stuff for a half an hour or an hour, and it could very well be gone. I know Reverend Al started the Dandelion Foundation group, and he retired and passed it on to us, where we have a van and can actually drive to people in the community to maybe if they're afraid of moving away from the home they've created for themselves, that we can go to them and provide help with housing and so on. But that's, there's a lot of people and they don't all have that access.
Yeah, we know that there's over 240 of them on the street right now, folks that are unsheltered. And that doesn't include those that are couch surfing or in emergency shelters. So certainly creating a little bit more. We know that we don't have enough room in the system right now for everybody who's unsheltered homeless to be sheltered. And that's something that we as society need to have a conversation about, knowing that as hard as we work to bring new housing on stream, it's going to take some time.
Number 3 is supporting people to access a range of physical, mental illness and addiction services and interventions, including trauma-informed counseling, institutional mental health care, complex care, primary care, transitional treatment, detox treatment, and recovery. And I know that we've actually been out there talking about having a conversation about even involuntary care when that's absolutely needed. We don't have to talk about that now, but certainly the main thing is to be able to have those range of programs for people to adjust to their needs.
Yeah, it feels, I'm looking at your 4-point plan that you sent to me, and it looks like number 4 is that ability for incarceration of a small number of bad operators on the street.
Yep.
So repeat offenders that are dangerous, extremely physically, sexually violent, or other types of offenses. So, and it ties, I think, into this conversation, because to me, it feels like that's the step you do when you know you've got your continuum of care and you still have folks that are unable to be met where they need to be met. And they themselves can't be kept safe in society. So keeping themselves in society safe. But to me, we have a responsibility to ensure that the services are there. If that individual wanted to access detox and hasn't been able to, then, ethically, I feel like we have to make sure that's available before we start talking about that last step.
Absolutely.
So I feel like there's some holes in the system we know exist already. We know there aren't enough detox beds, funded, adequately supported detox beds, culturally sensitive and appropriate care is missing in a number of places in that service continuum. So to me, we know where those holes are. As a society, it's on us to fill those holes and ensure that services are there for people to be met where they're at. I know that places like Redfish Healing Center over in Vancouver have been doing an amazing job of delivering across this continuum of services for folks that have dual diagnosis, mental health and addictions issues, and offering that in a culturally sensitive way. We know some great practices. We need to deliver a lot more of them and ensure that they're available locally for folks to meet at the time that they need it immediately, so that if that window's open for someone, they've got access to the service they need.
Right. Here locally, our place has a therapeutic recovery community and has 40 men here living at New Roads between 9 months and 2 years and working on their addictions. And the results have been amazing. And I do know that we're lobbying hard to the governments to be able to create a women's facility that provides similar care.
Yeah, and I know Anawim just got the funding to do a women's facility, which is amazing. And I know that the Aboriginal Coalition in Homelessness is opening some facilities as well. So I think that some of that is coming, but it doesn't feel like it's quite enough. We know where that hole is, because you can look at the wait lists, and also frontline workers know they're not even putting people on the wait list because they know there's no point. So we know we really know where some of those major holes are, and although there have been some great initiatives to move forward in filling some of that gap. So that balance of, harm reduction services and recovery-based services, so that there's that continuum for each person who at some point in time may need one or the other of those services that they're available. So I think there's some of those pieces are coming. It's great to see some of these amazing initiatives, some really great promising practices on quality of programs and delivery, but still falling far short of where we know that hole is that needs to be filled of services in our society.
Absolutely. Going back to the count, now that it's been completed, what does the Social Planning Council do with those numbers, and how do you move forward from here?
Well, exactly what we're doing today. We really, we're very committed to this initiative to ensure that that's an open conversation in the community about the data. The nice thing about the point in time count compared to something like a by name list or public data sets is that it's anonymous, and it's not, we make sure that there's, that any population that's so small that it might expose somebody's identity is not included, that it stays as an anonymous data set, and it can be used publicly, shared and engaged with in the community. And so it serves as a really great place to engage around what are the trends, how can we talk about what the needs are, what does this tell us, and it gives this renewed energy to the conversation around what do we need to do to end homelessness in our community.
Excellent. And we'll leave it there. The next count, like you said, will be in 2 or 3 years.
There's not yet a commitment to having a follow-up count. I know that there is some debate in the community around the role of by name lists versus point in time counts, and some communities combine those with registry week, and some don't. So that is a conversation that's ongoing with the stakeholders and community partners in the region. But I would hope to see this continue as an initiative because, as I said, it really does bring community together. It's an incredible awareness raising initiative with the volunteers and community that participates. It's an opportunity for anonymous engagement and sharing information about their stories for the community that feels less risky for a lot of them because it's anonymous. And then a policy engaged conversation with media and with the public around that comparable data. So it'd be nice to see it continue because it is something that's been done every few years. And that way you've got that continuing tracking of trends with a similar methodology and that publicly accessible open data conversation.
Absolutely, and it definitely stimulates conversation for us as well, and provides a better awareness of what's going on around our community. So we're very grateful. Diana Gibson, Executive Director of the Social Planning Council of Greater Victoria, thank you so much for part 1 and for part 2 of this conversation.
Thank you so much.
You've been listening to the Heart of the Matter podcast. For more information about Our Place and the vital programs and services provided to the Greater Victoria community, please go to www.ourplacesociety.com. Our Place is a registered BC charity. You can donate by visiting the website or by calling 250-940-5060. Help us to bring hope and belonging to those in need.